Dialogue with a Doctor, featuring Southwest Florida's leading physicians.
Welcome to Dialogue with a Doctor. This is a show where we have local physicians coming to speak and talk about their specialty or their craft, not only to teach you, but to let you know what's available for your purposes. My name is Dr. Gregory Leach, and I'm here this evening, or today, I should say, with Dr. Clint Potter. He's a practicing physician in Naples, Florida, and we will be talking about his specialty, which is age management medicine, functional medicine, integrative medicine. That's known by many words, which is confusing, but as a component of that, we'll be talking about hormone replacement therapy for men and women, or for women and men, which not many people know a lot about. But Dr. Potter, why don't you tell us about yourself, where you grew up and where you went to school, etc.
Thank you, Dr. Leach. I really appreciate the opportunity to be here and share my expertise with the people of Southwest Florida and Naples area. This is especially wonderful for me to be back here. I was born and raised in Miami, Florida, so I am a true Floridian, a cracker, if you will. I was born and raised in Miami on the other coast, but it was nonetheless a beautiful place to grow up. That was 50 years ago. Maybe it's changed a little bit, but still.
But you left for a while.
I did leave for a while. Undergrad, I went to USC, became a Trojan, and I studied psychobiology there. I did a double major honors program at USC. And after that program, I was accepted to Albert Einstein College of Medicine in New York, where I did went to medical school as a tough school, but a good school up in the Bronx. And then I was went back out west again. I was accepted to UCSF, one of the best schools in the country, UC San Francisco, for my medical residency training. I graduated residency and began practicing emergency medicine and critical care in the San Francisco area. And I did that for many years. And then as my career progressed, the hospital asked me to become their medical director of employee health and sit on the ethics committee and also do some infection control for the hospital. I ended up creating a workers' comp program in San Francisco, which was quite effective, and we prevented a lot of illness and injuries in our workers out there in San Francisco.
And that wasn't enough, then you went on.
That was not enough for me.
Learned anti-aging integrative medicine.
Well, you know,
you're a high achiever.
I am. I am a high achiever, thank you. My mom would be proud. But you know what I remember seeing, Dr. Leach, was in the emergency room and in the critical care units, what I saw was the result of people either not knowing how to take care of themselves, just not taking care of themselves, or falling victim to addictions or alcoholism or some other, illness. But really, a lot of what I saw, and it finally dawned on me a little while after I had been practicing in those really kind of in the trenches, in the emergency room, in the critical care unit. You're in the trenches of medicine, but it dawned on me that a lot of these patients maybe didn't even need to end up there. How did they get to that massive stroke? How did they get to that massive heart attack? How did they get to that diabetes that maybe could have been corrected? How did they get to that septicemia, that sepsis that comes on with not taking care of yourself or your body? Most of those patients were overweight. Most of those patients were malnourished. Most of those patients had risk factors that were changeable. And that's why I really was attracted to age management medicine. I realized that I myself am rapidly approaching 60, And, and I want to live as best I can live into my 80s, 90s, and 100s. We're now extending life. Everybody's got to start thinking, what am I going to look like when I'm 105, 110, 120? Our children and grandchildren are going to live to be 120 years old. So it's an interesting concept to think about. Most people think, oh, I'm not going to be around. You are going to be around. So how healthy do you want to be? So that's what age management for me is all about. And it involves three things: nutrition, exercise, and then as our bodies age, and our hormone levels naturally drop off because the organs in our body that make hormones, the thyroid, the pituitary, the testicles, the ovaries, they don't function as well as they do when we're in our late teens and 20s. Those are our reproductive years. That's when those organs really rev up. So when we start our late 40s, 50s, we start to feel those hormonal changes that come with aging. And we can talk about that if you'd like to do that.
So this is not just women, but men also.
Absolutely, absolutely. There has been discussion for many, many years now about menopause and premenopause, postmenopause, all the studies that were done, and classically we've talked about women, and women much more than men will freely talk about their menopausal symptoms. Women will talk about getting mad. They'll talk about getting foggy in the brain. They'll talk about hair loss. They'll talk about night sweats. They'll talk about putting on weight that they can't get off. They'll talk about not being able to get a good night's sleep. Men, however, we don't like to talk about it. We don't like to talk about stuff that's going on. We don't. It's kind of like not asking for directions, right? If I'm a man,
we don't ask for directions.
We don't ask for directions. We don't ask for help. But we feel all those things when our hormone levels drop off as well. So the way I like to look at it, when women go through menopause, their estrogen levels, estradiol levels, testosterone levels are up here, 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 here. They hit menopause and it's like falling off a cliff. So their symptoms happen, the onset happens faster, and it's a little bit more dramatic. In men, we also are cruising along, and our fall off of testosterone and our own estrogen levels, DHEA levels, some other thyroid levels, hormone levels, they also fall off, but the slope of the curve is not as dramatic. Our slope, we slope off more gradually, and it's not as dramatic as women do.
So it's a little sneakier.
It's a little sneakier, but nonetheless, we still feel all of those same symptoms, and we just don't talk about it. We don't talk about it. So, so it comes to I like to use the diagnosis of androgen deficiency in the adult male. A good acronym is ADAM. The diagnosis is ADAM, androgen deficiency in the adult male. That means your male-driven hormones start to fall off in the adult male. We know for a fact that male testosterone levels decrease up to 50% between the ages of 45 and 59. Dramatic drop-off in our testosterone levels, dramatic drop-off. And testosterone is a very important hormone. We think of it as a male hormone. It's not a male hormone. It is a female hormone. Females have testosterone receptors throughout their bodies, in their bones, in their brains, in their skin, in their breasts, in their legs, everywhere we have testosterone receptors. Men have estrogen receptors. Both men and women have estrogen and testosterone in varying degrees in their bodies. So when these hormones fall off and we rebalance them, these symptoms can improve. So we can measure chemically what we need to do. There are a couple of tests, simple tests, when you come into our offices in Naples on Goodlet Road at Advanced Medical. I give my patients, especially my male patients, what's called the ADAM questionnaire. It's a simple questionnaire that correlates with the level of testosterone and other hormones in the body. It's a 10 question questionnaire. Talks about things: do you have a decrease in libido? Do Do you have a lack of energy, decreased strength or endurance? Can you just not last as long as you used to at a particular event? Have you lost height? Are you a couple inches shorter than you were? Everybody wants to sit up a little taller when I ask that question. Have you noticed a decrease in enjoyment in life? So a lot of men, a lot of our symptoms are more subtle. You know, that you've heard that phrase, grumpy old men. There's a reason why that phrase, grumpy old men, exists. It's because when our testosterone levels, when our DHA levels drop, we get grumpy, we get short. We don't want to take the time to sit with our spouses anymore. We snap more. We become grumpy old men. We become grumpy old men.
We don't want that to happen.
And we don't want that to happen. And our wives don't want that to happen. And our partners don't want that to happen to us. Things also, you know, the more obvious stuff, Dr. Leach, that happens, of course, you know, is our libidos begin to change. We lose the ability to gain and maintain an erection, certainly as strong as they used to be. We lose those morning erections, now specifically speaking to men, of course. We lose our ability to stay awake. Our energy levels kind of drop off. Lots of my patients will come in and say, well, doctor, I know I'm going to crash at 3 p.m. every afternoon. I just run out of steam, I run out of energy. I got to take my afternoon nap. Afternoon napping doesn't have to be your normal part of your normal routine. And then also in men, what happens is we see a deterioration sometimes in their work performance or their motivational drive. It's more subtle. There are some more subtle things that happen. So there are other hormones. We've talked a lot about testosterone today.
What are you measuring?
Yeah, we are actually measuring, where the science is good enough now that we can measure hormone levels. So not just testosterone, but my favorite hormones that are involved with the aging process are estrogen, testosterone, thyroid hormone, progesterone, DHEA, we're going to get a little bit more specific now, and then specifically vitamin levels. Vitamin D is a hormone that occurs in the body. Cholecalciferol, that's what it's called. Bone health, bone strength, those hormones are important. Magnesium, calcium, potassium, all of those elements that make up the body are crucial. So we can measure all of that stuff. We can measure your body composition. We know we can measure whether that central weight gain that you've gotten over the last 5 or 10 years, and you can't get rid of it. You're never going to get rid of it because your hormones have changed. If I balance your hormones, then you're much more likely to be able to burn that fat off.
So what is the definition for our viewers, bioidentical hormone? What does that mean, and why should we use those?
Bioidentical hormone it's talked about in the literature a lot. I think it's one of the most confusing terms in the world that we talk about. I want to simplify it as best I can. So we all have these hormones that I've been talking about floating around our bodies everywhere, our brains, our hearts, all of our other organs. What we now are sophisticated enough to do is recreate the hormones as they look on a 3D model. So if I put up a 3D model in the air, those hormones look exactly like the hormones in my body. The hormones that patients have been given for the last 20, 30 years, 40 years now, are not bioidentical hormones. So the Premarin that was given to women back in the day, that comes from horse's urine. The many thyroid preparations come from pig thyroid that is ground up and desiccated. So bioidentical hormones are hormones that are now compounded in labs that are safe in our country, that are done here. I use a local compounding pharmacy here in Naples, very good, excellent quality control. Those hormones exactly match the hormones that are in our body. Big difference in safety.
So they are identical is what you're saying, and so you measure them and then you replace them, and then what happens? The patient comes back, or?
Patient, yes, yes. So we rebalance, we put the patients on whatever program they need to be on after we've given them a prescription for their nutrition, their lifestyle changes, exercise. Even if it's the simplest of programs, they just have to commit to something. They have to begin something. And then we rebalance their hormones, and they start to feel better within weeks.
So we briefly talked in another show about integrative medicine and functional anti-aging medicine at length. So what you're saying is when you see somebody for the hormones, really you're doing the complete comprehensive evaluation.
Absolutely.
As well.
You do not just come in. Yeah, these, it's a bit frightening that there are a lot of these T clinics popping up around, testosterone clinics popping up around. This stuff is serious science, and we can't just assume that it's okay for me, I don't feel good, let me go have my testosterone level checked. The doctor there needs to know what they're doing. This can be done safely, but it involves follow-up, it involves support, it involves knowing what you're doing, it involves things to watch out for. These hormone replacement is safe if it's done in a safe fashion. You can't just give testosterone in a vacuum. You can't give estrogen in a vacuum. You can make people sick if you do that. So that's not what we do. We evaluate your bones, your brain, your health, and all of the above. You'll spend all day in our clinic, and you'll meet with the doctor for a couple of hours. It'll design a whole program for you here in Naples.
Well, I've learned a lot, Dr. Potter, a lot more than I ever knew, and we want to thank you for coming on the show. And Dr. Potter can be reached we have a website on there at Advanced Medical, and we want to have you back to talk about more information when you have time. Thanks for coming.
My pleasure. Thank you very much, Dr. Leach.